chest pain, shortness of breath, and then everything changes. This is a heart attack. If you want to know more about it, be with us until the end of this video. A heart attack occurs when an artery that sends blood and oxygen to the heart is blocked. Fatty cholesterol-containing deposits build up over time, forming plaques in the heart's arteries. If a plaque ruptures, a blood clot can form. The clot can block arteries, causing a heart attack. During a heart attack, a lack of blood flow causes the tissue in a heart muscle to die. A heart attack is also called a myocardial infarction. Prompt treatment is needed for a heart attack to prevent death. Call 911 or emergency medical help if you think you might be having a heart attack. Symptoms of a heart attack vary. Some people have mild symptoms, others have severe symptoms. Some people have no symptoms. Common heart attack symptoms include chest pain that may feel like pressure, tightness, pain, squeezing or aching, pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth, or sometimes the upper belly, cold sweat, fatigue, heartburn or indigestion, nausea, shortness of breath. Women may have atypical symptoms such as brief or sharp pain felt in the neck, arm, or back. Sometimes the first symptom sign of a heart attack is sudden cardiac arrest. Some heart attacks strike suddenly, but many people have warning signs and symptoms hours, days, or weeks in advance. Chest pain or pressure that keeps happening and doesn't go away with the rest may be an early warning sign. Angina is caused by a temporary decrease in blood flow to the heart. Get help right away if you think you are having a heart attack. Take these steps. Call for emergency medical help. If you think you are having a heart attack, immediately call 911 or your local emergency number. If you don't have access to emergency medical services, have someone drive you to the nearest hospital. Drive yourself only if there are no other options. Take nitroglycerin if prescribed to you by a healthcare provider. Take it as instructed while awaiting emergency help. Take aspirin if recommended. Taking aspirin during a heart attack may reduce heart damage by preventing blood clotting. Aspirin can interact with other drugs. Don't take an aspirin unless your care provider or emergency medical personnel say to do so. Don't delay calling 911 to take an aspirin. Call for emergency help first. If someone is unconscious and you think they are having a heart attack, first call 911 or your local emergency number. Then check if the person is breathing and has a pulse. If the person isn't breathing or you don't find a pulse, only then should you begin CPR. If you are untrained in CPR, do hands-only CPR. That means push hard and fast on the person's chest, about 100 to 120 compressions a minute. If you are trained in CPR and confident in your ability, start with 30 chest compressions before giving 2 rescue breaths. Coronary artery disease causes most heart attack. In coronary artery disease, one or more of the heart arteries are blocked. This is usually due to cholesterol-containing deposits called plaques. Plaques can narrow the arteries, reducing blood flow to the heart. If a plaque breaks open, it can cause a blood clot in the heart. A heart attack may be caused by a complete or partial blockage of a heart artery. One way to classify heart attacks is whether an electrocardiogram ECG or EKG shows some specific changes like ST elevation that require emergency invasive treatment. Your heart care provider may use ECG results to describe these types of heart attacks. An acute complete blockage of a medium or large heart artery usually means you've had an ST elevation myocardial infarction. A partial blockage often means you've had a non-ST elevation myocardial infarction. However, some people with NSTEMI have a total blockage. Not all heart attacks are caused by blocked arteries. Other causes include coronary artery spasm. This is a severe squeezing of a blood vessel that's not blocked. The artery generally has cholesterol plaques. ODs is early hardening of the vessel due to smoking or other risk factors. Heart attack risk factors include age. Men age 45 and older and women age 55 and older are more likely to have a heart attack than are younger men and women. Tobacco use. This includes smoking and long-term exposure to second-hand smoke. If you smoke, quit. High blood pressure, high cholesterol or triglycerides. A high level of low-density lipoprotein LDL cholesterol is most likely to narrow arteries. A high level of certain blood fats called triglycerides also increases heart attack risk. Your heart attack risk may drop if levels of high density lipoprotein cholesterol, the good cholesterol, are in the standard range. Obesity, diabetes, metabolic syndrome, family history of heart attacks. If a brother, sister, parent, or grandparent had an early heart attack by age 55 for males and by age 65 for females, you might be an increased risk. Not enough exercise, unhealthy diet, stress, illegal drug use, a history of preeclampsia, and autoimmune conditions. It's never too late to take steps to prevent a heart attack, even if you've already had one. Here are ways to prevent a heart attack. Follow a healthy lifestyle. Don't smoke. Maintain a healthy weight with a heart-healthy diet. Manage other health conditions such as blood pressure and diabetes. Ask your healthcare provider how often you need checkups. Take medications as directed. Your healthcare provider may prescribe drugs to protect and improve your heart health. Thank you for being with us until the end of this video. Don't forget to subscribe our channel and see our other videos.